US President Donald Trump said that he has requested Prime Minister Narendra Modi to supply hydroxychloroquine tablets that can be used to treat COVID-19 patients. He said after a call with the Indian Prime Minister that India is giving serious consideration to releasing the hold it put on a US order for hydroxychloroquine. Well, to talk more about this drug that has been used for anti-malaria treatment and whether it can actually be used for preventing coronavirus, we're joined by Dr. Rommel Tickoo, Associate Director, Internal Medicine at Max Healthcare. Thank you for speaking to us, Doctor. If you could, there's been a lot of questions raised about the use of this drug. ICMR has also recommended that health professionals who are, in the front line of fighting this disease can use it. And but it's also led to all these tablets being sold out from various chemists, etc. So what is it? What is it really? What is the science in it?
See, whatever evidence we have about hydroxychloroquine till now, it shows that it does work in moderate to severe cases. Even in the French study, it was seen that about 80% of those moderate to severe cases on day 7 became negative and about 90% on day 8. So in moderate to severe cases, it does seem to be very promising, but it can't be used for mild cases. And we don't have enough evidence. We need more trials on this. But it is being used increasingly all over the world right now, since we don't have any other specific drug. We're waiting for more evidence, but it can be used. We can't wait. And even in India, it is being used in critical cases on case-to-case basis. We are even using it as prophylaxis. So the problem in US is that they had not, the US FDA had not approved it for use. But now with so many cases, they have approved it for emergency use. The problem could be that they are short of drugs there of hydroxychloroquine and they want more stocks. And since India is one of the biggest manufacturers of the drug, so they're looking at us. But India had put on hold the export of the drug. And probably that's the reason why President Trump wanted to speak to the Prime Minister so that we can lift the ban. It does seem to be promising. We need more evidence, but we don't have a choice. I think it should be used on case-to-case basis, especially in moderate to severe cases. And also for healthcare workers who are in touch with COVID patients and for the family members of COVID patients who are in close contact with them. So it can be used and should be used on case-to-case basis.
All right, sir, but also what are the dangers associated with it? There's a talk of a lot of side effects and also worries over people self-medicating. As we said, a lot of pharmacies in the country and, chemists, and ever since President Trump has been speaking about it and the ICMR recommended it, a lot of people have also, bought it off the counter. So what are the dangers there?
So it's not meant for mild cases, as I said. It's for moderate to severe cases. There is no need to do hoarding of this drug. It's only available on prescription. And there seems to be some sort of toxicity also associated with the drug. We all have been using it for many years for rheumatoid and other diseases. But it does have its toxicity, though it's more cumulative. And for prophylactic, it might not give too many side effects. But if it's used on a daily basis for mild cases, it might give you toxicity. The toxicity is related to heart. It increases the QT interval. So you might have to get in touch with your cardiologist, especially if you have cardiac problems. It does cause retinopathy, problems in the eyes. It does give you skin pigmentation, hair loss. And the mild symptoms are GI toxicity, vomiting, nausea. But again, having said that, these don't happen to everybody. We have to be more careful in the elderly population and in children, in whom it should be used with caution. But by and large, as I said, in moderate to severe cases, young people, it might not give you too much toxicity, but we should leave it for the physicians, for the doctors to decide in whom to use it, in whom not to use it.
All right, and finally, just to emphasize again, it can't be used as a preventive. Is that correct? That people shouldn't
It is being used. It is being used as prophylaxis. The ICMR guidelines tell us that it should be used for prophylaxis in healthcare workers who are treating such patients who are in close contact with COVID patients. They should take it once a week for 7 weeks. And the family members of COVID patients who are in close direct contact, they can also take it for 4 weeks, once a week. So it is being used as prophylaxis in India in certain population, which is basically healthcare workers treating such patients and family members of positive patients. Other than that, it is not being used for prophylaxis in India, and people should not hoard it. They should not buy it. In fact, it's not available now because people have bought it earlier when it was approved for use in such population. So there is no need to do any hoarding. I would still say that it's meant for a specific population. Everyone should not take it. And even there are some reports that toxicity and even death has happened in some cases. So we should not hoard it. We should leave it for the authorities to decide who should be treated, who should be given prophylaxis as far as this drug is concerned.
All right, Dr. Tickoo, thank you so much for speaking to NDTV and, telling us more about this drug that, as we just said, the U.S. President has asked India to release its hold on an order for this anti-malarial drug for export to the United States.